I see many nurses that are extremely good with nursing knowledge, with content. However, they lack the critical thinking part. And I will tell you this channel, NCLEX Crusade International channel, is about the only channel that I have seen in YouTube that really focuses on helping students develop critical thinking. That is my expertise. This is what I love. I love to do questions together with you, help you analyze, help you understand, help you to develop the ability to see keywords, the ability to see distractors. That is key to passing the NCLEX. And of course, teaching you strategies that you can develop to answer NCLEX style questions. Strategies are important. What strategies? Well, some of you know it. The assessment versus implementation strategy, Maslow's hierarchy of needs strategy, the SAR method strategy, and many, many other strategies that we teach within our academy. So, critical thinking along with strategies, prioritization strategy is key to passing the NCLEX. Also, you need to practice questions daily with a good Q bank, with a Q bank that offers quality questions, high difficulty style of questions. You don't want to use a question bank that offers you basic content only style of questions. You need to think. You need to understand why. So practice good questions so you can develop that critical thinking. All right. So here in our YouTube channel, we have many videos where we have practiced questions with you that you can use to develop that ability. But you need to get a Q bank and you need to practice questions. Okay. So talking about understanding the NCLEX and understanding the algorithm. So I want to let you know that when we talk about NCLEX, you need to understand that there are different style of questions. Well, what do you mean, Professor? What do you mean that there are different style of questions? Yes, there are different style of questions. There are questions that are easier. There are questions that are middle difficult, intermediate difficult, and there are questions that are very high. And the NCLEX is computer adaptive. What that means is that if you answer an NCLEX question correct, the computer is going to give you a harder question. If you answer that question correct, the computer will give you an even higher difficulty question. And at the same time, if you answer a question incorrectly, it will give you an easier question. Now, what determines the level of difficulty on the NCLEX question? That is going to be determined by something called the Bloom's taxonomy. So how do we put together Bloom's taxonomy and the NCLEX? Well, there are questions where basically the only thing you need to know is remember nursing content, basic values, or maybe basic medical knowledge.